Yeah, hi. My name is Dr. Sharat Damodar. I'm the clinical director and the head of adult hematology and BMT at the Mazumdar Shaw Cancer Center in Narayana Health City, Bangalore. The 28th of May is actually World Blood Cancer Day, and on this occasion, we would like to bring awareness about blood cancer and its treatment options. Now, blood cancer is something which generally produces fear into everybody who hears about it. About 20-30 years back also, it was always considered a death sentence for most people. But over the last 20-30 years, there's been a lot of progression in the diagnosis and the treatment of blood cancer. And in today's world, we can actually talk about curing blood cancer. Now, blood cancer is a subset of the liquid cancers, unlike the solid cancers like lung cancer or breast cancer, which are solid tumors which can be treated with surgery and radiotherapy. But the blood cancer, because it's a liquid cancer, it needs chemotherapy as part of its treatment. Now, about 20-30 years ago, chemotherapy was the only treatment available. And chemotherapy is like carpet bombing. You're going and hitting all the cells, you're killing the bad cells and the good cells, and thereby a lot of side effects because of the treatment. Now, as science has progressed and with a lot of improvements in technology, you're able to now identify, particular genetic aberrations or mutations, and we're able to target some of them. And with the advent of this, we started getting targeted therapies in the treatment of blood cancer. And we also started getting the antibody-based treatments, which are monoclonal antibodies, which can target the specific tumor cell or the cancer cell. This is like sniper shooting instead of carpet bombing, and thereby we are able to kill off the actual cancer cell and try and prevent damage to the normal cells. So in today's world, there are a lot of these monoclonal antibodies which are available, especially in the treatment of cancer. Specifically blood cancers, which help in our treatment. Now, in the childhood cancers, acute lymphatic leukemia has a high cure rate in the West. Cure rates of close to 90% are reported. Our own Indian data is in the 60 to 70% range. So clearly, we're getting better and better at treating these blood cancers, especially in children. But however, in some of the other leukemias like the myeloid leukemias and in leukemias in the adults, just chemotherapy is not enough, and we require something called a bone marrow transplant to cure these diseases. Now, in a bone marrow transplant, what happens is we give chemotherapy to destroy the patient's bone marrow and then use donor cells to put them in. Normally, the donor would be a brother or sister who's a fully matched donor. But nowadays, when you don't have a sibling who's matched, we can also get an unrelated donor from some of the donor registries in the world. India also has a large donor registry of about 4 to 5 lakh donors, but this is not enough for our country's population. So we need a larger number of people to come forth and become voluntary stem cell donors, just like how you are voluntary blood donors. So that way we can get a match and find some donor who can donate stem cells. There is no risk to the donor when he donates the stem cells. There's no problem at all. It's a daycare procedure. It finishes in about 2-3 hours. We generally give some injections for about 4-5 days before we collect the cells. We increase the cell count and then collect the cells and give it to the patient. So this is a nice modality of treatment. And nowadays we are also doing something called haplotransplant, where we can do half-matched donors' cells, which is either from the parent, the child, or from the sibling. And this has now helped to increase our donor pool for transplants. Now the newest therapy in blood cancers is something called immunotherapy. This is a new mechanism where we are able to use the patient's own cells, the T cells in the patient, get them to the lab, use a viral vector to change the receptor on the cell and then put the cell back so that it will go and target only the cancer cell. These are these chimeric antigen receptor T cells, and this is the newest modality of treatment in a lot of blood cancers like leukemia, lymphoma, myeloma. This is currently available in the US and Europe at a very high cost, but will be coming soon to India and definitely at our center. And we will be starting these treatments, and this will help a lot of our patients get completely cured of this disease like leukemia. So with that, I'd like to end on a note advising people, take care of your health, try and do annual checkups, make sure you're following a healthy pattern of living and eating, and this will certainly go a long way in preventing any type of cancer, and that is what I would like to say on this Blood Cancer Day. Thank you.